Well, good afternoon, everybody. Fantastic to be here today, and it looks like everybody truly enjoyed that fantastic lunch. So, in keeping with the spirit of queuing, which we heard a lot about today, I thought I should give us all a cue right here. So if you could, since it's after lunch, so if we could kindly make sure we don't have any lettuce stuck in our teeth. Pretty fantastic cue. So yeah, thank you for that fantastic introduction. I am here to talk a little bit about getting the most from your healthcare appointment. My name is Jackie, as Brad said, and I work with the Southwest Self-Management Program. So this is a program within the Southwest Community Care Access Center. How many of us know what the CCAC is? Just by a show of hands. Okay, so there's quite a few of you. Fantastic. So the Community Care Access Center organizes care for people in the community. That could be a multitude of different types of care, physical care, home care, things like that. And what my program does, so my program is housed within the Southwest CCAC, and we offer healthy living education to patients such as ourselves, so community members, in helping them to become more empowered, confident, and informed patients. But we also work with service providers in helping them, and that could be doctors, nurses, physiotherapists, things like that. So we also offer them education in order to help us, help the patient on their journey to greater self-efficacy. So before we get started, I wanted all of us to just think a little bit about our healthcare teams. All of us have a healthcare team. So, and just thinking a little bit about who the members of our healthcare team are. So we would have doctors, and that would include specialists such as neurologists. We've got pharmacists, chiropractors, physiotherapists, registered massage therapists. The list can go on and on. Care coordinators, psychologists, social workers, dietitians. So there's quite a few people that are on our healthcare teams, particularly when we're people that have a chronic condition. But a lot of the time, we forget who the most important part of our healthcare team is. And if anybody in this room knows who that person is, just shout it out. Yourself, absolutely. Thank you very much. All right, I just want to draw everyone's attention to something that's called the Excellent Care for All Act. By a show of hands as well, how many people have heard of this? 1, 2, so 2 out of 150. That's pretty staggering. So I'll tell you a little bit about this act, and this is, and it was said a few times today by a few different speakers, knowledge is power. So you knowing this act hopefully can start that transition to becoming a more active member of your healthcare team. So the Excellent Care of All Act became law in June of 2010. So the Excellent Care Act became law in June of 2010. And the purpose of this legislation is to put patients first by strengthening the healthcare sector's organizational focus and accountability to deliver high-quality patient care. So this act states, and the expectations of this act state that patients should feel encouraged to ask questions, that patients feel that they are involved in the decisions that are made about their care, and that patients feel that they have enough time with their healthcare provider. So in essence, this act supports our program. It supports patient partnerships in their healthcare team. And it also supports the health profession in supporting that as well by things like establishing a patient relations process to address and improve patient care. So this is just a pretty powerful quote. It could be a little bit hard to take sometimes, but once I explain it, I'm sure it'll resonate with you like it does with me. So the moment you take responsibility for everything in your life is the moment that you can change anything in your life. Now, there are a lot of things in our lives that we have absolutely no control over. For instance, a diagnosis of Parkinson's disease. But what we do have control of is what we do with our diagnoses and what we do with the information that we gather and how we implement that into our own lives. So there was a show of hands earlier with regards to how many people of the room have Parkinson's disease. I just want to broaden that to all chronic conditions. So out of everybody in this room, if you have a chronic condition, raise your hand. And that could be anything from, I have high blood pressure and chronic pain, but that could be a multitude of things. It could be diabetes, it could be Parkinson's disease, heart disease. So out of everybody in this room, if you have at least one chronic condition, raise your hand. Pretty staggering stuff. So, and that goes along with the statistics that go with that question. 80% of people in Ontario, 80% over the age of 45 have a chronic condition. Out of that 80%, 70% of us have 2 or more chronic conditions. Those are pretty staggering statistics. So I mentioned earlier that you're the most important person on your healthcare team, and there really is research that backs that up. So the research is this. So on average, a person living with a chronic condition, which is 80% of us, spends on average 12.5 hours a year with a member of our healthcare team. So that's everybody all together. That could be a few different specialists, a nurse, a dietitian, a social worker, but all of those appointments all added up together for people with chronic conditions, 12.5 hours on average. So that means that for the other 364.5 days out of the year, we're managing our own health. So what this means, in essence, again, is that you are the most important person on your healthcare team. It's important to keep in mind that if the majority of the information that we gather happens within that 12.5 hours, we need to make sure that we are an active member on our health team so that we can get the most out of our healthcare appointments and act on what we've learned on that other 364.5 days of the year. So as the most important person on your healthcare team, it's crucial that we share all of the information that we know with all of the members of our healthcare team. And think about it, you're the only one that knows everything. Most of us don't have somebody waking up with us in the morning and, looking at everything that we're doing and whether or not we took our medication, what time we took our medication, if we took our medication in some cases. So you're the only person that knows that. So the term self-management is a person's active participation in achieving his or her best health and wellness. And that involves gaining the confidence, the knowledge, and the skills to be able to manage all aspects of one's life. So the physical aspects, the emotional aspects, and the social aspects. So during the rest of the time that we have together, we're going to take a look at some really concrete tips and tools that I hope will help all of you to be able to get the most health benefits from your appointments. So we know that the most effective way to have any sort of a positive outcome with anything that we're doing in our lives is to create a plan and execute it. So we create plans for all sorts of different things in our lives, like paying down our mortgages, like saving up for university for one of our kids, to home renovations projects, even taking a vacation to Hawaii. So one thing that we know for sure is that there seems to be somewhat of a disconnect between this mindset of planning when it comes to our healthcare appointments. So most of us don't actually create a plan around our health. So if we want to be successful, it's really important that we do so, and we need to make sure that we include things like, what is this appointment for? What exactly is happening here? What kind of tests, what is all this for? And what do I want to accomplish by going through this process and visiting with this person? So over the next few slides, like I said, we're just going to take a look at some helpful tips and tools to help us create that plan and execute it with regards to our healthcare. So just some tips for making an appointment to get us started. So here's a few tips on the slide there to help us to work with the administrative personnel. I know personally, and I still, even though with regards to what I do for a living, I know that sometimes I still feel a little bit like my privacy is being invaded when the person at the front desk that's making that appointment for me asks, so what would you like to see the doctor about? And I'm sure a lot of us in the room have said, you know, that's private, I'll let the doctor know when I see them. But these roles, the administrative roles, tend to be the organizational roles and the gatekeepers of the doctor's time. So they have quite a bit of control over when we see the doctor and for how long we see the doctor. For instance, if we're making an appointment for a full physical, that's a different amount of time than if we're just going to go in for a prescription renewal, right? So that kind of makes sense with regards to that. So it's really super important for us to understand that that person may not be a doctor, but they still are a healthcare professional. And there's nothing that we could tell them that we should feel embarrassed about, because they truly have heard everything. So it's really important to have that honesty. All right, so preparing for the visit. Things that you should try and consider prior to any one of your health service appointments is making a list of concerns or questions that you want to talk about. And I loved how it was mentioned today that priority should be you prioritizing that list with regards to what is important to you. Our health and our being, it's a very personal thing. So something that the doctor or another provider that you're visiting with might think that these certain things are the most important, but it needs to be what you feel is the most important. This is your life, and this is your happiness and your well-being. So writing everything down and making sure that you share the entire list. Now, even in situations, I'm very aware that there may be situations where your physician, let's say, might say, well, we can only discuss one issue during this visit. But that said, it is very important for you to read that entire list to them, and a useful tool would be to make two lists and give one to the physician. so that they have one and you have one. And it's really important to go through that whole list because there may be a question or concern or a symptom that might send off a red flag. And there may be multiple symptoms that point to a single possible diagnosis. So it's very important to make sure that you mention all of those things. A health diary. And I tried to start you off with a little mini one at your table. I was dropping off some packages around your table. There's a MedRec book on your tables for each of you. So it's important not only to mention when you feel bad. It is very important to mention when you feel good too, and how can we build on that, right? So this is very helpful because sometimes we have a symptom or feel a certain way after taking a medication, but by the time we get around to having that follow-up appointment with our practitioner, that's kind of become the new normal for you, right? So it's very important to make sure that you record all of those things and date them. Medication lists. How many people in this room have a medication list? How many of you have it on your person? Fantastic, that's wonderful. It is very important that we have a complete list on our person because I'm not sure how it is here in Walkerton or wherever it is that everyone else is from, but I don't know of any paramedic that's gonna stop by your house on the way to the hospital. So having that medication list on your person is a very useful tip. Making sure that we list everything. Please don't only put your prescription medication on that list. It should be every vitamin, every supplement, every topical ointment like Voltaren. Everything needs to be on that list. Just a little story of how important that is. So I worked with a lovely fellow, about my age, fantastic man, just a real good person. And this real good person was suffering for many, many, many years with kidney stones. I'm not sure if anybody in this room has ever had a kidney stone or has known anybody who's ever had a kidney stone, but pretty painful stuff. So now imagine my friend after years, and we're talking about 15, 20 years of suffering with kidney stones, in and out of the hospital, laser to break up the stone at times so he could pass it because they got to be so large, too large to pass. So imagine my friend's dismay when he realized after years of suffering, and it was the pharmacist who caught this finally, that after years of suffering, he found out he was causing his kidney stones himself. This gentleman, not unlike many of us, I know my mom, as soon as winter came, would pop vitamin C into our mouths every morning before we went to school, but this man took it a step too far and was taking what we call megadoses of vitamin C in an effort to ward off disease. It serves as an antioxidant, but he was unknowingly causing his own kidney stones because that's what excessive megadoses of vitamin C over a long period of time does. Your kidneys can't filter all that, so the poor gentleman was causing his kidney stones, so just an example. Preparing for your visit. So does anybody do research themselves on the World Wide Web? You do? Good. Good. It is very important for you to do research, not only with friends and family members or in a group like this with other people who have had the same conditions, because we all gain information and learn from each other. But it's great to be able to do your research online, contrary to what a lot of people tell you. So, but what's really important to consider is that we're visiting reputable sites. So, some reputable sites, and I have actually a reference sheet for anybody interested. I didn't pass them out at the tables, but for anybody who's interested, they're at the back, so it has this information on those sheets. So addresses ending in .edu are educational institutions. .org, such as the National Council on Aging, are not-for-profit and quite reputable. .gov are government institutions. For instance, the Ministry of Health and Long-Term Care. .ca is the country code for Canada, and believe it or not, people do have to meet a whole certain set of criteria in order to get the .ca. And .gc.ca, such as the Public Health Agency of Canada. And it's really important to watch the links that, that you start clicking on when you're on any one site, because a lot of those can lead you to particular pharmaceutical companies and different things like that. And a lot of those sites are just end up scaring us and end up tricking us into purchasing certain things online. So just to be aware and making sure that we're visiting reputable sites to do our research. Oh, sorry, I'm having a little bit of a technical difficulty. Okay, so just to recap and thinking of the things that we should bring to our visit, bring any of your questions or comments, your medication list to every single appointment. Please do not assume that if you're seeing someone that they know what you are on. It is very important to bring that list. Your health history, family history, things like that as well. Any of your research information. Tests, that's not so necessary these days with the age of electronics. A lot of them do have those tests that have come from the hospital or other sources. And this is what I would like to call a med buddy, is someone that you trust. Someone to be the minute taker at your meetings. So it could be a friend, a family member, a partner, a spouse, someone that you could bring with you that you are a med buddy with. So you could pay them the same, pay it forward to them as well, right? So just think about it for a second. Even in business meetings, for anybody who's been to a meeting, there's always a minute taker, right? So that minute taker is there so that they can accurately record whatever happened at that meeting, so that the rest of the people that are actually participating in the meeting can concentrate on participating and getting the most out of that meeting. So, but unfortunately, we don't do that with the most important meetings of our lives, which are our healthcare appointments. So, like I said, this might be one of the most effective strategies because we know that there's a higher degree of the information being recorded being that objective third-party information, because it can be quite stressful when you're attending your healthcare appointments, and half the time our judgment is clouded because of our emotions. So it's good to have that third party there. So just a couple of things that we're going to talk about with regards to what we can do during our visit. So just quickly, just by a show of hands, so I guess true being hand up and false being hand down, most healthcare providers interrupt their patients when they're telling their stories within 20 seconds. Do you believe that to be true or false? Okay. Seems that many of the people in this room have a fantastic medical team. So the answer is true. Most healthcare providers do interrupt their patients within 20 seconds. Studies show that a lot of the time people don't have a lot of time to be able to tell their whole story. But if that time was allotted, that most people, when they walk into a doctor's office, have finished their whole story within 2 minutes. So if being allowed to have that time, they generally finish within 2 minutes. So you have information about yourself that nobody knows. And if the healthcare provider that you are working with does not hear your whole story and they don't have all the facts, then in essence, what they're doing is just making an educated guess with regards to your diagnosis without all of the information. So being an active member of your healthcare team means sharing that very important information. Just remembering that health service providers are human beings too. So it's important for us to remember that they can have bad days or very, very, very busy ones, and that they are human beings, and that it's a partnership. So it's just as much about what we do as what they do. So if one of your service providers does interrupt you, there's very appropriate ways that we can start this conversation with them. Maybe saying something like, Dr. Smith, I understand that you have a very busy day today. I've seen all the people waiting in the waiting room, but I need to be able to finish my whole list and tell you everything that's wrong so that you can make an accurate diagnosis. So saying something like that and just cueing that person is a really good way to start. So there are all kinds of reasons that people don't work well with their healthcare professionals. Sometimes it is because of a difficult emotion or a difficult feeling that we're having because of our condition or the actual appointment. Sometimes it's because we're afraid of what we're going to hear if we actually give that person all of that information. Sometimes we're embarrassed because we haven't been doing exactly what we should be doing and we don't want to admit that. For instance, not taking our medication as prescribed, and all of us have been guilty of that at one time or another. So, and sometimes we feel like we're being a nuisance, particularly when that waiting room is full. It's like you feel almost like you don't want to take up that person's time, so you just kind of spit it out, don't tell the whole story, and that's not really good for anybody. So just some important questions that you should be able to answer before you leave is, why do I need to do this? So if there's a prescribed treatment for your diagnosis, why do I need to do this? A lot of the times, if we don't truly understand, then we won't. For instance, with the use of antibiotics, a lot of people, after they're feeling good for a couple of days, discontinue the use and don't pay attention to the, please finish the whole bottle. There's someone that had attended one of my workshops, and she had mentioned that the doctor had put her on blood pressure medication. Now, the woman felt fine. A lot of the times you can't tell if you have high or low blood pressure, and she felt fine, so she did not understand why she was put on that medication. So it was pretty challenging for her to follow that regimen because she didn't truly understand or feel that it was needed. So at her follow-up appointment with her physician, she brought that question up, and she explained that to him. And he explained to her how serious high blood pressure is, explained that if uncontrolled, high blood pressure can lead to very severe health problems, and that high blood pressure is the #1 cause of stroke. So after she learned this and after she truly understood, it made a lot of sense to this individual for her to begin taking her medication as prescribed. So having that knowledge, and again, that knowledge is power. So just some other questions to consider. What can I expect? Are there side effects to this treatment? And again, would these side effects be important to me? Sometimes the side effects of any kind of treatment have a more detrimental, it's more detrimental to you as a person looking at you and being an individual. For instance, if, with regards to Parkinson's, how Some people don't mind so much having those tremors, right? It's the side effects of their medication that are really bothersome to them. So it means that you look at yourself and you decide for yourself what is important to you. It's very individualistic. How will this affect my everyday life? Should I drive on this medication? Paying close attention to all of those warnings. Is there anything I should eat or not eat? And who should I talk to if I have any questions? A lot of the times it's not the physician. It might be a dietitian or a pharmacist or a nurse. So making sure that you know who you can call. Just going to share a little video with you. Is the volume up there, guys? Are we good?
Well, sometimes doctors make mistakes. Anna, you need to try twice as hard to fix them. Are you using your inhaler?
All the time. Go through one a week.
You sure you're using it right?
Do I look like an idiot?
No. Why don't you show me how your inhaler works?
Yeah, I'm still upset they took him off the air, eh? Gosh, love that guy. So I do know that this video is a little over the top, but it shows how important it is to ask those questions before leaving your appointment. So Dr. House asks the patient to show how she uses her inhaler. This is called teach back. And it shows the service provider that you understand. So obviously this wasn't done when she had gone originally to get the inhaler. So this teach back tool is a method that healthcare professionals encourage their patients to use, but it doesn't always happen for many reasons. And we want to encourage you to start that conversation if your health service provider does not start that discussion. So there is a teach back card inside your packages there. It says stay on track with teach back. So it says inside, it's not a good idea to tell your healthcare provider that you understand when you don't. It's up to both of us, for the doctor to say, do you understand? And for us to be honest about that and tell the truth about that. So here's how it works. So there's a few little quotes there to get you started. So my challenge is for you to take this to your next appointment and pull it out to cue you on what to say. So the first one is, let me see if I understand this correctly, and then continue on with the explanation. So there are some pretty fantastic statistics that go along with this. So people remember, on average, 10% of what they read. That's all, 10%. 20% of what they hear, 30% of what they see, 50% of what they see and hear simultaneously, and 90% of what they teach back. So just that act of repeating it back to the person or teaching it back or showing how to use an inhaler will help us to retain 90%. So those are some pretty fantastic statistics there. And here is just another example. Everybody see it? So before you leave, make sure you understand. So this poor gentleman, take with meals, no problem. I eat all the time. So it's important, again, being the most important person on your healthcare team, that you take the lead. Medical words are a foreign language. Healthcare providers don't mean to talk in a different lingo or acronyms or anything like that, but much like other workplaces, short forms and acronyms are used. So for people without that healthcare background, it is, in essence, another language. So just an example of that, I worked in residential support services for quite some time. And there was one instance where a nurse had come in to do a joint admission with me for someone that was having their admission to the residence. And she came into the office, and I gave her the person's file. And she opened up the file, and she saw the admission on the chalkboard, and she went white. It was like all the blood had just drained from her face. I didn't know what was wrong. This was the first time I had met this person, so I asked if she was okay, and she said to me, she says, I don't understand. I don't understand why you didn't call me sooner. Have you called the paramedics? What did you do? And I'm sitting there just very confused. And I asked her, I said, for what? She said, for the DOA. And yeah, so in residential services, it means date of arrival, but this poor nurse walked in thinking that this person was dead on arrival. So, yeah, so it's really important for us to be cognizant of how we are coming across to that other person. And it really helps with communication with your spouse as well. So make sure that there's a good understanding there. So before leaving, we need to make sure that we understand what our health service providers are telling us. We need to know how to get more information once we're home and who to contact for further questions. A lot of the times, like I said, it's calling maybe a diabetes educator or something like that. It might be somebody totally different that you should be following up with. And is follow-up needed, or and with whom? A lot of the times, one of the major complaints I hear, and I've actually been through it myself as well, is you get home and you could have sworn that you were supposed to see a specialist, but you're kind of unsure if you should have stopped at the front desk and if they're going to make the appointment for you and who's going to be calling you. So you're kind of just sitting there, and then you end up calling the doctor's office back and wasting a whole bunch of time when, we could have just asked right then and there. So that's pretty important. How do I know if my medicine or treatment is working? A lot of the times you're not sure. So that could lead to us not adhering to our prescribed treatment because we're not even sure. And how do I know if something is wrong? So what should I be watching for? Are there any side effects, things like that I should be watching for? And a lot of the times it's the pharmacist that will be able to answer all those questions. Your pharmacists are a fantastic resource, particularly now with that they're able to do the med check and have those appointments with you. Does everybody in this room know what I'm talking about? Have a med check? No. Okay, well, you can go into the pharmacy and ask for an actual appointment with your pharmacist. And they will take that list, and like we talked about, it has to be everything on that list, all your supplements and creams and everything else, and they will do a med review with you. So, and this is covered. So if the next time you're in your pharmacy, maybe that would be a good idea just to check out that resource. It's a fantastic resource. So at many of our appointments, we're given so many things that we should be doing. For individuals diagnosed with Parkinson's disease, there are about 35 things you're sent home to do. You need to take your meds, monitor your tremors, get exercise, buy proper footwear, make an appointment with the OT, PT, RMT, and the list goes on and on. So all of these things are really, really important, but it is so overwhelming that you just don't know where to start. So I want to share just quickly a tool to help get us started that can be really helpful in starting to make some of those plans and create a plan for our health. So it's called an action plan. It's a tool that we learn about in our workshop. So I put these on the table for you as well, and if you're interested, please call us and let us know. This program, it's called Living a Healthy Life, even with a chronic condition. So I'll just stop there for a second. And I didn't mention before, all of our programs are fully funded by the Ministry of Health and Long-Term Care and the Southwest Local Health Integration Network. So all of our programming comes for free to participants. So our goal is to get out there and try and create stronger and healthier communities. So if you are interested, please take a look at those brochures I left for you on the table. And I'll be here for the rest of the day and for anybody who stays later if they have any questions. So this is a tool that we work with in the Living a Healthy Life workshop. So this workshop goes on 2.5 hours, 1 day a week for 6 weeks. So we practice this action planning tool throughout the whole workshop. So by the end of the 6 weeks, we get pretty good at setting action plans. So I've been signaled. Is that 5 minutes? Yeah? Okay. So it's all about small steps towards change. That's what the action plan is. Small steps that really do work. Studies have shown this action plan, just like with all of our healthy living programming, was all researched for many, many years, over 30 years at Stanford University. So tried, tested, and true. So action planning has to be something that you want to do. Not that your doctor tells you, not that your spouse tells you or your children. It needs to be something that you want to do. It needs to be achievable. So losing 30 pounds within the month of January is not something that's achievable. It needs to be action specific. Again, losing weight is not action specific. It's all of those things that we do that result in that. And it needs to answer the questions what, how, when, and how often. So an example of that is, what am I going to do? This week, I'm going to walk. How much am I going to do it? I'm going to go around the block. And where am I going to do it? So I'm going to do it before lunch. And how many days of the week am I going to do it? So 3 times. I'm going to do it Monday, Tuesday, Wednesday. So it's very, very action specific. I wanted to, and again, I left those sheets that I left at the back there. I wanted to leave you with some resources as well. Just very quickly, the Living a Healthy Life workshop we talked about. If anybody's having trouble getting a family practitioner, the phone number's there. The Community Care Access Center, if you're needing a little bit of help at home, and you've decided to do that so that you can stay in your home, you can call the Community Care Access Center. And if you are looking for a community service, how many people in this room have heard of the Healthline? Oh my goodness, that's a lot of people. Okay, so just very quickly, the Southwest Healthline is a fantastic resource. Again, it's on that reference sheet I left at the back for you. It looks after the whole Southwest, so it's my region. So everything Grey Bruce, Huron, Perth, London, Middlesex, Oxford County, and Elgin. So, and it has, gosh, so many resources. All you have to do is click on your area, let's say Grey Bruce, and look for resources, and it'll just pull them up. And there's a search bar and a help bar in the upper right-hand corner as well, so you could type in something like, I don't know, Parkinson's support group, and then it'll just bring all of them, all of those up in the body of the tool there. So fantastic, fantastic resource. So do we have time for, if anybody has a question? Rose? So just while she's getting the microphone, I just wanted to leave you with a final thought. My honest hope is, from our time together, that I left you feeling just a little bit more empowered to take charge and to become a true participating member of your healthcare team. Okay, does anybody have any questions?